Hi, my name is Sheryl Orozco, and my grandson, Gage, is a patient here at Cure for the Kids. Because of his medical issue and all the medications that he's taken, I've noticed that it had started affecting his teeth. He was having some tooth pain in the back on the right. I was referred to the pediatric dentist. The pediatric dentist read through Gage's files, saw his condition, his brain tumor, the diabetes insipidus, the 4 different medications that he's on, and they said, we can't help you right now. I mean, we can do an x-ray, we can do a cleaning, but that would be the most that we can do. There's no, I mean, he needed to have a tooth extracted on the bottom and the back. He had a broken tooth, I believe, up on the top in the far corner back here. You know, those back teeth where it's kind of hard to get to when you're brushing. And being hospitalized, you don't always have that toothbrush and that toothpaste handy. You're not always taking care of your teeth. You're more concerned about the immediate issue right then and there. Let's say, is it his diabetes insipidus? Is it his brain tumor? We're in the hospital. I'm not thinking, oh, and by the way, Gage, you forgot to brush your teeth today. When we finally got our appointment with Roseman Dental, we came in, we saw Dr. Cottom. He was amazing. His staff is amazing. Gage was really nervous, obviously. He hadn't been to a dentist in, as far as I know, in years. Gage was, he was the happiest little kid to come in here, flirt with all the ladies, shake Dr. Cottom's hand, and let's get to this. And, he was like, we're done. And he's like, yeah, we're done. He couldn't believe it. He was like, we're done? That was so fast.
That's awesome.
It was. And for Gage, now he doesn't have that anxiety of going to the dentist. He's like, oh, we're going to Dr. Cottom's? All right, let's go. He doesn't, most kids get that dental anxiety when you have all these medical issues and all you see is doctors and nurses and pokes and prods and this, and to come in, and it was a comforting experience. He didn't, Dr. Cottom, because he's visually impaired, that makes life a lot more stressful. Just that right there. Not knowing what's going to happen. What are they going to be doing? Dr. Cottom talked him through every little step. All right, Gage, I'm coming in. I'm going to give you a little poke. This is the medication that's going to numb your mouth, and it's going to help me make you better. And Gage he was great with it. He didn't cry. He didn't have a meltdown or anything. And this is the first time in Gage's history of seeing doctors that he did not have that initial meltdown before we began the procedures. Simple things like blood work cause a meltdown for him. So for us to get through the entire situation, the procedures in two different sittings, and without any stress at all, he handled it like a champ. I was so amazed.